Well, the first thing you need to understand, let me say right away, is that there are two types of strokes: ischemic stroke and hemorrhagic stroke. Ischemia means a lack of blood flow. A stroke occurs, brain tissue dies, nerve cells are lost because for a certain period blood did not reach a part of the brain. This is ischemia. That's what an ischemic stroke is. In other words, for one reason or another, blood did not reach a specific part of the brain. So in this case, the exact cause doesn't matter. And some of the nerve cells stop functioning, die off, and perish. And instead of nerve cells, neurons, the area is taken over by connective tissue of a neural type called neuroglia, which are the supporting nerve cells. Sometimes a cyst forms, and this forms the basis of an ischemic stroke. And the function that these areas of the brain were responsible for is lost or impaired, sometimes irreversibly. Now, as for a hemorrhagic stroke, hemo means blood and ragia means outflow or spreading. So a hemorrhagic stroke is correctly translated as a brain hemorrhage. This is when a blood vessel bursts and blood spills into the brain tissue. Let me say right away, blood is under a certain pressure inside the vessels. We call this blood pressure. Naturally, the blood starts to flow into the nerve tissue under pressure, high pressure, and this blood causes massive destruction of the nerve tissue. I think we'll talk more about this in the next video. Don't miss it. Here's a quick announcement. Hemorrhagic stroke is a little different. Today we're going to talk about ischemic strokes. But first, friends, look, as we've already discussed in previous videos, there are only 4 arteries that carry blood to the head. From the spine, on the right and left sides, inside the transverse processes of the vertebrae are the vertebral arteries. The vertebral arteries merge into a single artery called the main or basilar artery. Here are the vertebral arteries, and here is the basilar artery. But this accounts for only 30% of the blood flow. And the remaining 70% of the blood supply comes from the carotid arteries, not the external, but the common carotid arteries, which then divide into the external carotid artery, supplying blood to the face, and the internal carotid artery supplying blood to the head. All these arteries, the basilar and carotid arteries, converge at the base of the brain to form a special structure called the circle of Willis. In other words, they merge and provide backup for each other. That's why the blockage of one or even 2 of these main arteries is generally not immediately or critically fatal for the brain. But even though there is redundancy and overlapping blood flow, our brain still has 2 main blood supply basins, the carotid arteries known as the carotid basin. These are the frontal lobes, the parietal lobes, the occipital lobes, the temporal lobes, the cerebral cortexes are supplied by the carotid arteries, and essentially they supply the main part of our brain, providing the primary blood flow to the brain regions responsible for the main functions of our head. But the vertebrobasilar system is the main artery that essentially runs through the brainstem. It supplies the medulla oblongata, the pons, the midbrain, the diencephalon, and the cerebellum. And the vertebral artery, the vertebrobasilar blood supply system, essentially provides blood flow to the brainstem, including the cranial nerves. And that's why strokes and cerebrovascular disorders are, in principle, divided into 2 categories based on the symptoms that occur. There are strokes in the carotid basin of the carotid arteries, and separately there are cerebrovascular disorder strokes in the vertebrobasilar arteries, in the vertebrobasilar basin. Causes? Well, there can be several causes. From what I highlight, one is vascular spasm. So why do vascular spasms occur? Spasms most often occur because of the influence of certain stress factors. For example, a person receives some unexpected news, experiences anxiety, or goes through some emotional stress. 2 processes happen. Adrenaline is released in the adrenal glands, and the sympathetic nervous system is activated. Both the first and the second cause vascular spasm. And against the background of already critically poor blood supply to the head, such a spasm can lead to a situation where a certain area of the brain, which was already receiving little blood flow, gets even less. And as a result, the nerve cells simply don't have enough energy resources to perform their functions. And this spasm occurs. As a result, the person becomes paralyzed. The person begins to experience neurological symptoms. These nerves, stress as we call it, this vascular spasm, that's the first cause. The second cause is vascular thrombosis. Blood clots have entered. These are the so-called frequent lacunar strokes, when clots enter the carotid artery and then travel along the branches, moving further and further until they block some small branch. As a result, the person has a lacunar stroke. That is, in this case, the supply of oxygen to a very small area of the brain is cut off, and the person might not even feel anything. As a neurologist, I often encounter this. I take a scan, and on the scan I see 3 or 4 traces of strokes. That is, the person has had 3 or 4 strokes without knowing anything about them. In other words, these strokes went completely unnoticed by the person. How is that possible? Well, that's just how it is. Because these strokes affected only a small area of the brain. Some neurological impairments may have occurred, but the person didn't notice them. These so-called lacunar strokes are caused by small clots. By the way, just to avoid any misconceptions, remember this: clots do not travel from the veins in our legs. Clots from veins cannot reach the brain. People often say a clot broke off and traveled somewhere. Guys, that's complete nonsense. The clots involved are arterial, not venous. And arterial clots do not form in the veins of the legs, but in the arteries. Specifically, clots most often form on the heart valves in a condition called atrial fibrillation, when the normal sequential laminar blood flow in the heart is disrupted, causing turbulence in the blood, and that's where clots form. And by the way, in all the people in whom I happen to observe laminaro, I mean these localized strokes, that is, areas of the brain affected in a specific way, it always turns out that they have heart rhythm problems, that is, arrhythmias or irregularities in the heartbeat. Lacunar strokes usually occur precisely because of this. Vascular insufficiency is a condition in which there is a sharp drop in blood pressure. Sometimes this happens during collapse-like states. Sometimes in people who already have vegetative vascular insufficiency or dystonia, in people who may experience this when their blood pressure drops even further during sleep. These are hypotonics. It can also occur in people who have experienced bleeding and as a result have lost a significant amount of blood. This leads to ischemia, brain hypoperfusion, and vascular insufficiency. It is a lack of blood flow due to decreased vascular tone and lowered blood pressure. In such cases, ischemic changes can also develop in the structure of the brain. Vascular emboli. This can occur with fat embolism, drug embolism, or as a result of improper medical procedures. In this case, an embolus is essentially a vessel blocked by some kind of embolus air or fat something enters the vessels, like a thrombus, like a clot that travels to the brain and cuts off the blood supply to a particular branch of the vessels. Prolonged ischemia, MIL, is essentially the same as vascular insufficiency. I'll explain what this cause is. This is a common condition in people who have the bad habit of sleeping on their side or on their stomach. When a person sleeps on their side, they turn their neck, or on their stomach, they bend their neck, turn their neck, and for a long time while the person is sleeping, blood does not reach the head. Usually sleeping on your side or stomach, of course, leads to chronic disturbances of cerebral circulation, to dyscirculatory encephalopathy. But in some cases, after sleep, a person wakes up with a weakened arm or leg, the corner of their mouth is turned, and speech problems begin. In other words, these are typical signs of a stroke after sleep. Those strokes that occur after sleep are the result of prolonged ischemia caused by an improper head position during sleep. So here's some good advice right away, guys. Sleep on your back, then at least you can protect yourself from these kinds of strokes. Well, there's also atherosclerosis of the blood vessels, which is a factor that causes a daily decrease in blood flow to the head, chronic hypertension and heart dysfunction. But these systemic diseases generally cause impaired blood circulation. And in principle, this includes blood flow to the head as well. These are the main causes of strokes. The mechanism of development is exactly what I've been describing. So a thrombus enters and blocks a specific artery. That's it. This area of the brain is now deprived of blood supply. Hypoxia begins to develop there. Cells deprived of oxygen can't break down glucose, can't provide themselves with those charged batteries, the ATP molecules, and because of this, they suffer energetically. At first, they can't perform their function and suffer functionally. Later, they even suffer organically as the nerve cells begin to break down. In place of the nerve cells, neuroglia starts to form. This is like the connective tissue of the nervous system. But the nerve cells that carried out the main function of the nervous system are gone. They can no longer perform their function. How do these disturbances of cerebral circulation manifest themselves? How do strokes manifest? This is what we discussed in previous lessons as we approached this topic. General cerebral disturbances appear, but in the case of ischemic strokes, they are less pronounced. General cerebral symptoms include headaches, impaired consciousness, nausea, and dizziness. It's less. They are more pronounced in hemorrhagic strokes. The main manifestation is focal lesions of the nervous system. The part of the nervous system that is affected loses the function it used to perform. The main symptom is hemiparesis. Hemi means half of the body. So paresis is a decrease in strength. Paralysis is the complete absence of movement, meaning strength is zero. And hemi means on one side of the body, this includes the face, arm, and leg on the same side, and usually on the opposite side. So if a stroke occurs in the right hemisphere of the brain, the left arm, left leg, and left side of the face stop functioning, and the corner of the mouth is pulled up. There may also be disturbances related to the eyes. If the stroke is in the left hemisphere of the brain, the right arm and leg stop functioning and speech is lost. In right-handed people, speech is lost and practical skills are lost as well. This loss of speech is called aphasia. Sensitivity is lost if the sensory areas in our brain are affected. Vision can also be lost, with a wide variety of visual field defects depending on the area affected. Hearing is affected less often, since that's the temporal lobe, but it can even lead to epileptic seizures. In other words, there is damage to the neurons of the cortex itself. And these general brain disorders are divided into the carotid basin, the carotid arteries. Most often this manifests as paresis, hypesthesia, which is reduced sensitivity, higher brain functions, or the cerebrovascular basin, where the vertebral arteries are affected. In that case, the so-called bulbar syndrome is characteristic. Let me explain. Bulbous means bulb, referring to the bulb of the brain, which is the brain stem. And the main function there is swallowing, the execution of the swallowing reflex. So when bulbar syndrome occurs, as a result of a stroke, a person loses the natural swallowing reflex. That is, a person chokes on water, coughs when eating, the function of the throat and larynx muscles is impaired, and because of this, they have problems with eating and drinking. This is what is called bulbar syndrome. In such cases, they even need help with eating, even with something as simple as drinking water. For the vertebrobasilar system, coordination disorders are typical. This involves the cerebellum. Lesions of the cranial nerves are also characteristic. This can be related to the face. By the way, there is a difference between damage to the facial nerve itself and stroke-related lesions. With facial nerve damage, the entire face is affected, whereas with stroke lesions, only the lower part of the face is involved, because the upper part of the face receives bilateral innervation. And Cranial nerves are affected as well, which is also associated with various oculomotor disturbances. There may be manifestations of sensory impairments. In other words, a wide variety of neurological disorders can occur. And essentially, they depend on the specific area of the brain where the stroke developed. But I'll say it again. As a neurologist, I very often encounter situations where people come to me, and to be honest, I examine them very carefully as a neurologist. And after thoroughly studying their symptoms, I don't find the symptoms I would expect based on the CT scan results. In other words, quite often after a stroke, there is actually a very strong and good recovery of functions. Recovery is possible. Understand that recovery is possible. And that's why even after having a stroke, recovery often leads to a situation where a person is left without any neurological deficit, without the symptoms they previously had. I examine a person who has had a stroke. 10 years have passed. Usually after a stroke, at least the Babinski reflex remains. I do a little examination on the heel. I check the Babinski reflex on the foot. I scratch, and I don't even find it. Even though the stroke is present in the medical history and the stroke is still visible as changes on the CT scan, yes. So all these various impairments manifest themselves specifically in the area that was affected during the stroke. Diagnosis, by the way, is made only by observing the progression of the disease, by how the illness develops, and by the symptoms that I, as a neurologist, detect. And of course, the CT scan is used for confirmation. Well, that was in the past. Now, we use magnetic resonance imaging, which shows morphological changes in the nervous system, in nerve tissue deprived of blood flow. And in this way, we confirm the localization, the placement of the stroke, the extent of the stroke, and its treatment. Look, friends, when I talk about stroke, whether it's ischemic or hemorrhagic, when I talk about stroke, I always say that stroke is not a disease. Stroke is an event. That is, if this event has already happened, then in that case, we can't undo anything. It's like a car accident. If it has already happened, then it has happened. That's it. You can't go back. You can't return to the past. If a stroke has already occurred, then it has already happened, and changes in the brain tissue have already taken place. And that's why the treatment of strokes generally consists of, carefully eliminating the underlying causes that led to the stroke, and also trying to restore as much as possible the function of the affected areas of the brain by relying, so to speak, on neighboring regions, on other parts of the brain in order to try to recover function. But do you understand the point? Essentially, it's impossible to cure this disease. But when I meet people who have had a stroke, I always ask, what was the cause? Well, maybe it was hypertension or blood clots or something to do with the blood. All right, the stroke happened. Now, have you eliminated the causes of this stroke? Because if you haven't addressed the causes, you remain at risk of having a second or even a third stroke. And so it goes on until the nervous system can no longer withstand such a number of strokes. That's why in the case of a stroke, it's absolutely necessary to eliminate the causes that led to it. As for the immediate treatment, it's about stabilizing vital functions, ensuring breathing, heartbeat, addressing heart rhythm disturbances, and if necessary, taking anti-edema measures to reduce swelling in the nervous system. Wherever the nerve tissue has been damaged, swelling will develop there, just like in an inflammatory process. That's why anti-edema measures and improving cerebral blood flow are important. But look, I always say this. If a person has a crooked neck, and because of that they had a stroke, even in the hospital when treating a stroke, these are usually paralyzed people in diapers, often unconscious. Do you understand what improving cerebral blood flow really means? This comes from a neurologist's practical experience. That is, people who have a stroke are brought to, well, the intensive care unit or the neurology department. They are laid on their backs well because sometimes they need IV drips, sometimes they have catheters, are intubated, and so they are placed on their backs. And the most surprising thing is that even without any medical intervention, by the third or fourth day, people start to feel better. Do you understand why it is better? Because perhaps for the first time in their lives, these people started lying on their backs. Because they started lying on their backs and they can't turn onto their sides, since they're paralyzed. As a result, the blood flow through their vertebral arteries improves, yes. And because of this, the blood supply to the brain improves. So when it comes to improving cerebral blood flow, it's important to ensure a good, proper head position, at least during sleep. This is the best thing we can do for the vertebral arteries. Sometimes vasodilator medications are used, but they only affect the carotid arteries. As for the vertebral artery, which is located inside the bony canal, vasodilator medications, I'm sorry to say, do not work. It's impossible. So here, the correct head position during sleep, vasodilator medications, and improving the condition of the neck are important. Massage can also be performed. Sometimes people ask me, how soon after a stroke can you do roller massage of the spine or spinal traction using equipment like Turmenium massagers? The answer is as early as the second day after a stroke. Yes. On the second day, you can already use a massage bed because it stretches, aligns, and straightens the neck for the person. Yes. So here as well, the use of a massage traction bed is appropriate. Improvement of blood rheology. Well, they try injecting or infusing various antiplatelet and anticoagulant drugs, such as pentoxifylline, also known as Trental, or agapurin. Well, to be honest, yes, we try in some way to influence blood coagulation, the blood clotting system, to make the blood thinner. I'll be straightforward, it doesn't work. Personally, I have looked under the microscope at thousands of people who take blood thinning medications. The blood remains thick, it just mechanically stays thick. And that's why, in this case, improving blood rheology is achieved not even by taking medication, but by simply intravenously administering a large amount of fluid to improve blood rheology and flow. The thing is, strokes usually happen to people who drink little water. They drink little water, and because of this, their blood not just thick, but highly concentrated ends up with a poor hematocrit level, meaning there are many cells and little fluid. In other words, like croutons. They start getting IV drips, and accordingly, it's not even particularly important what exactly they're being given. They simply start to feel better because they're being given intravenously a polarizing mixture or just electrolytes. And this already provides, let's say, a good restoration of blood fluidity. As for me, I restore blood fluidity by making sure people sleep on a mat made of turmenium magnetic alloy, turmenium ceramic. As a result, a person's blood becomes magnetized, and this significantly improves, in any case, the rheological properties of the blood. By the way, for people who have suffered a stroke, it is recommended to sleep on turmenium ceramic from the very first day after the stroke, which greatly improves this particular factor blood fluidity. And of course, it also helps stabilize blood pressure. But while hypertension is usually treated with medications that affect the kidneys like ACE inhibitors and other such things in this case, it's strictly emergency measures. Vasodilator drugs, diuretics that remove excess fluid from the body in cases of swelling of the nervous system. But the fight to normalize blood pressure can mean not necessarily lowering it. Sometimes it's actually raising it. So in cases of low blood pressure, that means using cordiamin or even adrenaline to raise the pressure if needed, you see? And this is a necessary condition for the brain to continue receiving good blood supply so that the consequences of a stroke don't get worse and may even be reduced. That's why normalizing the body's blood pressure overall, as well as addressing heart problems using antiarrhythmic drugs, for example, to improve heart function, is important so that the heart doesn't become a source of blood clots again. As for the nourishment of nerve tissue, I'll be honest with you, speaking from my experience as a neurologist, I've never really seen any results from it. These include various drugs like octavagene, cerebrolysin, and possibly some nootropic medications, although those are mostly used during the recovery period. And I repeat, their results are more imagined than real questionable, to say the least. Although, well, they are also included as part of the overall treatment. And this is essentially how the problem of strokes is addressed. I repeat, we do not treat the stroke itself. We simply try to restore the functions that were lost as a result of the stroke. Sometimes we manage to do this more or less successfully, sometimes less so. But in any case, this needs to be done during the recovery period. Of course, we also use electrical neuromuscular stimulation. Electroneuromusculation is when we use electrical impulses to act on the extremities, on the arms and legs in an attempt to restore nerve function, because electrical impulses help restore nerve conductivity. Although, once again, it is not the peripheral nerve that suffers during a stroke, but the central nerve, the one in the brain. Restoring it with electrical neurostimulation can sometimes be more difficult, much more difficult,